Hey everyone, this is Kimberly Miller, your holistic health expert, owner of Healing with Excellence, and we're here today for another new episode of the Healing with Excellence podcast. And I have Eric joining me today, a client that was suffering with chronic pelvic floor pain. And we just want to kind of give some insight as to what he was going through and how we first connected and what his progress was after we met. So Eric, welcome to the show.
Hello, Kim. Thanks for the invite.
Yeah, I'm so grateful for you to be here, especially after everything you went through.
Thanks. Yeah, my name is Eric Thumb. I live in nearby Kim, Citrus Springs, Florida, and a lot to share. I think we're going to try to keep this 40 minutes or less.
Yeah.
Um, I had some, I don't know, I could start just talking from the time I called you, I guess.
Sure. Yeah. If you want to give like what happened prior to calling me and then why you reached out. And yeah, Eric and I could probably talk all day about multiple topics with this
Yeah,
and to other people that he's met, and he's helped save a lot of people since we've met. But yeah, Eric, what was happening before you called me that led you to getting in contact with me, and how'd you learn about me and helping you?
right. So about 10 months before I called Kim, I took a long road trip, and on the trip I was experiencing some pain. I didn't know what it was. I hadn't been to a doctor in like 10 or 15 years. And it was like I don't know, the best I could describe it was a pain in my prostate area. And I felt this like interruption in being able to eliminate or urinate. And it was like unusual and scary. And I just drove home. It was a long, drive from Buffalo home. Within a few days, it was really bad, and like pull over on the side of the road bad, but it was intermittent. It would come and go. So um, I went to the doctor right away, and they just threw some antibiotics at it. They thought it was a infection, and that didn't work. And I went back and we tried a different antibiotic, and all said and done, 3 or 4 doctors. I'll call acupuncturist doctors because I went to a doctor, and then he sent me after 2 failed attempts with antibiotic, he sent me to a urologist. Now 6 or 7 weeks have gone by, and I've had a colonoscopy now, and then I've had a cystoscopy, and 2 more rounds of antibiotic that are different. A friend at work gave me some antibiotic that makes round 4 of antibiotic, and 6 rounds of antibiotic all said and done in 10 months. And the cystoscopy, the colonoscopy, and also CT scan, and they found nothing. And I thought by my own research, I had interstitial cystitis, and that might be like 6 months into this. The pain was, come and go, but when it was there, it was, I worked through it, but it was pretty unbearable. It was, I don't know if it really was a 10, but at times it felt like, if it was a 10, I wouldn't be able to go to work. But there were times where I went to work where I would pull over and lay on the pavement and like assume positions like knees to chest or just try to do something to relieve it.
Mhm.
And then I had my third and fourth attempt was helping was this is like 8, 9 months in, was acupuncture. And a local acupuncturist said he agreed it was interstitial cystitis, bladder spasm,
Mhm.
which I don't think it was. And then he said, whatever, but if you would go to my mentor, 35 years experience, PhDs in Sarasota, he could help you faster than I could. So I was game. I drove to Sarasota. I bought all the Chinese herbs. I did what he wanted for 2 sessions, spent hundreds of dollars, and that didn't do any good either. So I told this to a friend of mine at Publix, and a guy named Scott. He recommended you. He said he had taken his daughter to you and twice, and in 2 sessions she was better, healed. I had nothing to lose, so then I called you, and you heard this song and dance for 40 minutes on the phone, and you listened, and and then you told me that you think you could help me in 1 or 2 sessions,
Mhm.
and I was thinking, well, I don't even know what I have. Here I am on an elimination diet, thinking I have bladder spasm, lost 30 pounds, eating almonds and blueberries for a month, still in pain, urinating 20 to 60 times a day, trying to, and it would hurt or it wouldn't work. Um, so then I was eager to make the appointment, and I think I saw you like a week later, and you, we talked for what, 90 minutes? and
Yeah.
I had
Yes.
some diet advice, and tried to find out a history of what I've been through, and former traumas, and muscle testing. And I mean, I could spill the beans and say, yeah, you found what was wrong. And
Yeah, no, well, yeah. So when you called, I happened to be driving home from somewhere else. So I wasn't in my office yet when you called the first time, just to kind of get an idea if I could help you. And so I was grateful that I had the time driving to be able to spend communicating, because I could hear how overwhelmed you were. And I don't always get 40 minutes to chat with somebody about their history. But I knew after everything you've been through and a lot of false hope, that it's still very hard to say, like, okay, I'm going to drive up to this girl. Now, luckily I was closer to Sarasota, and some people have had to fly to me, or do virtual, but you're like, I'm going to drive to this girl. The evaluation's like $400. And if I have to meet her multiple times, am I going to be able to afford this, invest into it? Because, traditional PT, it's like 12 sessions. Well, nobody wants to pay me 12 times, $200 to $400. But what I explain to people, because I'm going to be able to find things much faster, like one session might be equivalent to 12 PT sessions, or even no sessions, no other practitioner, because we're actually going to find the root cause. And because my main goal is to support you when you're not with me. So after you meet me, if you have questions and that, I'm going to, of course, support you through that after you've been through all that trauma. So as you know, when you come for a wellness evaluation, it's not just about that evaluation. There's a follow-up email, there's a support system. So after you and I talked about that for a while, it sounded like you're like, okay, let me give this a try, and you trusted.
yeah.
And you did come, and I remember saying that I believe it would be corrected in under 3 sessions, hopefully 1 to 2. And again, I said, I know I might sound crazy, but I see this lots of times, and I feel like we have an answer. So we did that first session, and I don't know if it's hard for you to remember, but how did you feel after you left the first wellness evaluation with the corrective exercises for your pelvic floor muscles?
Going on memory, I would really say I'm about 99% sure I didn't feel better right away. Like
No.
after that first session. I was just doing what by faith, like what you said to do. It was simple. I was laying on the ground, with my knee bent, out a certain angle, and pulsing, pushing my heel into a floor 10 times, flexing my glute without flexing my lower back. And that it was and rubbing a certain part of my body that was connected to that issue, like my neck, I think. And it was just a simple thing to do, and I was just going through the motions doing it and hoping it would work. I mean, I would have done anything. So it was easy to just do this, even if I didn't really. I don't think I really understood, but
No.
I wanted it to work. I'm not sure I believed it, but I was super cooperative, because I was just at my wit's end, you know. And the diet change was easy. There was, instruction to eat more, to increase the protein, clean up the diet, and organic as much as possible, which I really enjoyed. I like beef, so that was all. That was an easy part. And then by the second session, after the second session, I think I started noticing some benefit, and then there was one particular day where I had a lot of pain, even after the 2 sessions. And I called you. I had found this happy baby pose on YouTube. And I was a weekend, I was like in Epsom salt baths trying to relieve pain any way I could, because a hot compress in the pelvic area would help briefly.
Right.
But the Epsom salt bath wasn't working, and I between the correctives you showed me, and then that feet to ceiling happy baby pose, I'm not kidding. The pain it was like you flipped a switch. It finally went away. And that was it. I don't know if I followed up a third time, like within a month, or that was months later.
I think it was months later, if I remember correctly, and then we
Yeah.
were following up with a different family member. So you and I just checked in, and we didn't do like
Yeah.
a official session. But no,
But it
and
was
I
pretty much a
remember.
2 month window, maybe 6 weeks, 8 weeks. It was
Mhm.
absolutely gone. And it was no like, well, it came back a twinge. I mean, for me personally, it was like, it feels like flipping a switch. It just, I went from a person that woke up with burning, and, you know, with this uncomfortable scenario where you had to try to eliminate 20 or 60 times a day to someone that could go like back to normal 3 times a day if you wanted, or twice a day, or four.
Yeah.
It was miraculous. It was miraculous.
I know. Well, I remember the one day you had the bad flare and we spoke too, and I asked you what you ate, and I explained how when your
Yes.
body is in a compromised state, it becomes more sensitive to even foods you might have eaten all the time. And so I think, let's give an example. This isn't, exact what happened, but let's say that day you had some nuts and like went a little while without eating a meal. I was explaining how that would prevent the nervous system from making the correction or might create a flare. So then you doubled down just a little bit more on how you were nourishing yourself. Because I think you were working, was it 3 jobs at the time or two?
Two. And I
Okay.
still am all this time. Like
Yeah. Yeah.
I
And
was then, and the sleep was minimal. And you say, well, you must have goals, and you didn't um, address that yet. And
yeah, exactly.
I do remember talking about, you said that about the diet. And I
Mhm.
had fessed up that I had cooked some meat in crock pot or something, but I had a very aggressive batch of spices in there, like
Mhm.
paprika and all kind of stuff. And I think maybe there was some concern that some of the spices might have activated like a
Mhm.
problem.
Yeah, and sometimes those pre-made packs will have like MSG that will impact people. But yeah, I know we talked about a few things like that. And again, like I'd mentioned, it takes like up to 30 days sometimes for the nervous system to rewrite the compensation. So what was happening with Eric, one of his pelvic floor muscles were compensating neurologically for one of his glute muscles. So the muscles closest to like the testicle, the perineum, were contracting at the force of what a glute max or the glute muscle should be contracting at, and then the glute wasn't coming to the table effectively. So that puts a lot of pressure and force in that area, impacting, again, either the nerves, the blood flow, or the urethra. And so once he did these correctives for a period of time, the nervous system stopped with that bad habit and started working more effectively like it did initially before the stress came, before the long drive, before the changes in diet. And so he got back to being able to eat like a normal person's diet versus almonds and blueberries. And
Yeah.
he was able to lose some body fat. He healed the pelvic floor. And again, that was within 2 sessions. And that was going on about a year by the time we met, right?
Yeah.
Okay.
Yeah. It was, yeah, it was a year. I remember I want to say it was August 19th when I
Mhm.
saw you the first
Okay.
time. And it
Okay.
was about 10 months. Those are the two like things I have in my mind. August 19th was the day I would say, yeah, I was on the road to getting out of this issue. And it was 10 months of pain before that. Yeah. It
Yeah.
was,
Now, let me ask you, because the corrective exercise, a lot of people don't realize they're literally about 2 minutes, maybe
oh,
three
yeah.
times a day. So it wasn't like you had to go do an hour and a half PT routine. But I want to
No.
ask you, out of everything you went through, the cystoscopy, I can never say that word right, the GI, the colonoscopy, and all the exams, which do you feel was the least evasive out of everybody you saw, was as far as my visit and their visits?
Oh, for sure. Your visit. Oh, my God. Absolutely. Hands down. I mean, yeah. I mean, not only the actual comparing the process, you're going under you're going under, what do you call it? Anesthesia twice
Wow. Yeah, you're
for
right.
for two of these three things. Going to an office multiple times.
Mm,
Um, you're hoping that they don't do anything wrong. They're
mhm.
putting something in your body the size of a small pressure washer in a pretty small part of your body. It's
Yes.
like it's kind of scary. Where I didn't know what you were going to do, but it wasn't scary.
Mm,
It wasn't scary at all.
that's
It
good.
was the bigger challenge was like actually somebody do it was so simple, like do actually being
Yeah.
willing to do the simple. That was the bigger challenge. Yeah. But if
Yeah.
you're in enough pain, you'll do it.
Yeah, and to trust that it's going to work for sure. But no, I
Yeah.
know when I was younger, my chronic health issues, I had three total colonoscopies. One failed, so we had to do it a third time. So three colonoscopies by the time I was 21. And just the preparation for the colonoscopy
Oh
is
yeah.
the exhaust, you know how that is. So it's just you're going through, like I went through so many things too, and so many co-pays and so many
Yep.
purchases of supplements, like you said. Now, what would you estimate over the course of the 10 months that you paid financially, not including your lost work time or your drive time?
I have insurance, so I still probably end up paying 4 grand. at least. I would say 5 grand.
That's
I think
crazy.
that's a pretty good estimate. I still have a small bill open right now with the hospital. And I just put it out on a 3-year plan and pay them so much a month for 3 years. Like
Mm.
I'm still paying some of that.
Yeah.
Yeah. And with
I
and so and yours was just okay, today's this much and paid it and done. And yeah, and go, 2, 3 times.
mhm.
And then not only that, reaching out. I had these tests done and there's no like there's a follow-up, not even with the doctor that said he was going to do it. The
Mhm.
doctor that they said was going to do the process didn't do it. His partner did it. You have to make an appointment to find anything out. Whereas with Kim, there's she made herself super available. I'll just say that.
Mhm.
Whenever I needed, uh, whether it was a text message or an email. I think an email is a little more appropriate because it's not as like, in her pocket. It's when she's available to help you,
Mhm.
but whatever Kim works out with you is what she works out with you,
Yeah. But no, well, and it happens because to me, when someone's been suffering for that long and they need to feel faith and confidence and support, and to me, I find that people heal faster just feeling like they're getting a competent answer
Oh yeah.
and someone really listening and someone helping to address the fears or frustration when there's a flare. And I know not every practitioner would be willing to do that, but I know for me, if I can help you heal in 1 to 3 sessions and us both get to celebrate that, that is to me just as rewarding as you getting the relief. And again, some people have asked me in the past, like, how do you make money to pay your bills if people heal in 3 sessions? Well, if one person tells 40 people and I work 40
Yeah.
more hours with 40 people healing versus seeing you 40 times and you being depressed and me being depressed, like, why would I want to work that? And anybody that knows Eric knows that he has told everybody and anybody about his experience. So we've been able to help a lot of people through that interaction for sure.
I don't know how many people have reached out. I know I've probably told 80 to 100 people. I
Wow.
I know I have. I know
Yeah.
I have. Whether it's in an airport somewhere, uh, or at work, or just yeah. So I would hope at least 20 reached back. I don't
Hmm.
really know. I don't know. I know
Yeah.
a handful that have. I know maybe 4 or 5 that have.
Yeah. Well, and as you know, um, some people are going to be bought in, some people are going to take a while. When I started learning about some of this stuff, it took me 1 to 3 years before I really pulled the trigger because I was scared I was going to have to change all these things, or I knew I was going to have to change some things, and I wasn't ready because I was brainwashed into a different way of living. But what's interesting, I tell people all the time, once you realize sometimes you don't have to change much, sometimes you just change 2 things and everything gets better. I had such chronic ailments, though, that I really had to do an overhaul of how I eat, think, breathe. But I've had people that have chronic addictions of some sort, and literally just 2 corrections help them. And so it just depends on the person. Everybody's different. But yeah, I've been very grateful because a lot of the people you have referred have had some kind of positive outcome or a complete healing. And some people are on their journey to continue to heal. They might have had a 40-year problem that's going to take a couple years, but as a whole, it's amazing to see everybody getting better in some way and feeling empowered versus fearful or like they have no power, like powerless.
Right.
It's a big
One
difference.
thing I was hoping to mention was the doctor's response. So the first doctor I went to,
Mhm.
I occasionally go with my wife. She goes regularly to him, and I was able to tell him, what happened, and I was just shocked how not lack of interest.
Mhm.
You could just tell he didn't. To me, if someone had a serious problem and then I referred him to another doctor, and that didn't work, and then a year later you come back and tell me what happened, I think I would be kind of interested, like, well, I'd be leaning in, like, what happened. And he just was smiling, just like basically ignoring it. It's like a happy face doctor. My next appointment's in 3 minutes. Are you done yet? Like he didn't care, at
No,
all.
it's
That
scary.
was,
Go ahead.
yes, it is scary. Hey, we trust these people and give them money. That's like, I'm
Yeah,
sure
well,
there's purpose, the appendicitis or this or that, but
mhm.
after this experience, you don't really want to go back.
No, it's sad. And we do need physicians for some things like, I
Yeah.
said that like my daughter needed that major internal surgery with her
Yeah.
accident. But I just don't think modern medicine is good at handling like vague symptoms or things when they're not a crisis yet. Sometimes they're hard
Hmm.
at preventative care versus just chasing symptoms. But I can
Right.
tell you that was the most disheartening thing for me early on in my career. I thought that osteoporosis wasn't reversible because that's what I was trained. But then I had a client back in the day that I was just doing personal training with. And I said, gosh, I think her bones are healing based on what I'm seeing in her reports. And we had just changed some things in her diet and her exercise program to help her prevent a digression or like a progression of her osteoporosis and to help her with weight loss. And when I was doing special measurements, I'm like, gosh, I think she's reversing the bone loss. And all of a sudden she goes to her 2-year DEXA scan after being my client as a personal training client for 2 years. And we only trained together twice a week, not even like really that hard because she was older. And
Mhm.
literally in 2 years, this woman from 65 to 67 completely reversed osteoporosis that she had for more than 5 years.
That's
Well,
incredible.
she told her doctor, her rheumatologist, what she did. And he's like, oh, that's great. Keep doing it. She's the only patient out of 3,000 patients in his office that reversed osteoporosis. And he did not want to know how. He just said,
Yeah.
keep doing what you're doing. And that
That's
was so shocking. She
yeah.
kept going to him as a patient. He didn't lose her as a patient, but he did not want to know how to help his other clients.
Yeah.
And that was just insane to
Yeah.
me.
No questions. Like, who did you see? What did you do? No, nothing. Just
Right.
like, he was polite, but it was like he was looking at a piece of bad furniture in an antique store. Like he didn't even care. There was no,
It's
yeah.
sad. Yeah, yeah. No, and I even cross-refer to physicians, so it's not like I don't believe in medicine. So to me, if we had a good relationship built professionally to create the best patient outcomes and to like prevent failed discharges at the hospital, to me, I think that's amazing to see so many miracles happening. And again, it's not a miracle, it's science, but it's just a blessing to see so many people healing. And luckily, there are physicians I'm connected with that do understand, but the majority still don't, understand how this type of stuff works or don't understand nutrition and neuromuscular connections. I'm just grateful we were able to connect, and I was grateful that you tried to share because you did your part.
Yeah. Thanks.
No, it's good. But no, as a whole, I felt it was a blessing. I was grateful that I wasn't lying to you when I said under 3 sessions. Because some of my colleagues are scared to quote time because they don't want to plant false hope. And I
Yeah.
understand that. And I tell people all the time, I'm not going to give you false hope. If I'm telling you something can heal, I know it can heal. And if I'm fearful that the person's not going to be as committed to their own healing, I'm going to let them know, like, I know this can heal, but I'm a little scared that you might not treat your body better, or that you might not do this for yourself, or that you have low faith. So I let them know because I don't want to drag people through false hope. And I don't want to ruin my personal professional integrity or, my connection with God. I have to be honest about what I'm doing, but I'm just grateful that you got to experience that.
Right. And prayer was definitely part of it. You're praying that to be healed.
Mhm.
Um, I have a friend at Publix, and he prayed for me in the store. Like he literally laid hands on me in the store and prayed. And if you're ashamed to pray in public, maybe that's where you are. I wouldn't say I wasn't that person. That wouldn't feel a little weird in a store with 100 people around you. But
Mhm.
when you're down, you're like, let's roll with it. Let's do it. And we
Yeah.
did that just before, this all turned around as well. So that's a
Ah,
part of it too. If you have that, it's
yeah.
whatever tools are in your toolbox. Like you say,
Use
if you
them.
need a doctor, you need a doctor for surgery.
Mhm.
If you can do this as a preventative or when it's mild, then run with this,
Mhm.
and pray.
Yeah, and now you have to refresh my memory. I could go back to my emails, but what was it 2023 or 2022 that we met?
Um,
Because now it's 2024. I guess it was last year, right?
it
I feel like it's been two
that was
years.
2 years ago. It was
Okay.
because it was I would say it was to 2022 because we had this is a trip this all trip this well my pain probably was 2022 because it was we had driven home from Buffalo
Oh,
in
it was
the
2022.
winter.
I just looked it up. It's 2022.
Yeah. So I want
So,
to say the pain started in October of 2022. Yeah.
Yes, so well, no, it must have been 21 because you and I, my first email to you was
Okay.
July 19th of 2022.
Okay.
So
Yeah. So in
what's
October of 2021, we're driving home, the pain's starting. And the first email to between us was when?
I
July?
messaged you on July 19th for your confirmation of 2022. So what's amazing, we
Yeah.
are pretty much almost 2 years exactly out, and you've never had
Wow.
that return.
Not one flare. None. And you're
Amazing.
not talking to a person with the pin, I don't know if it's wise to, I'll just say I'm relatively healthy, but my sleep schedule's lacking, work 2 jobs and
Yeah.
yeah. So I'm not really giving my body what it even needs to maintain great health, but thank God it has, Yeah.
Yeah, so it shows that like just a little bit of love and attention to the body can still work. You don't have to be perfect.
Yeah, that's
And you're,
true. Yeah, I'm
yeah,
not doing these correctives. I'm not eating the perfect diet, always. So yeah,
yeah.
so and my wife's had the same experience. I mean, we came what, a year ago, and
Hmm.
she had an issue in her hand. We were convinced it was a carpal tunnel and ready to do a surgery. And the correctives you found was the pain was not really, it was coming from like through the arm and the shoulder and the neck. When the neck problem made sense because of migraine headaches.
Hmm.
And we're going to work on, up the neck and shoulder first, and then the arm, and then get to the hand. And we didn't get that far with her treatment, but the little bit that she was willing to do and the diet change that she did, I asked her like and we hadn't seen you in for a year with Jody.
Hmm. Yeah.
And I asked her like, I want to say 3 weeks ago, does your hand even hurt anymore? And she said, no. I was
Yeah.
like that's where it
Yeah.
used to be all the time. So the
And
little
she
bit
was
she did.
contemplating like MRI. Did she need surgery? I remember her asking me all that. I'm like, no, no, no,
Yeah.
you don't need any of that.
Yeah.
Yeah.
Yeah. And imagine if she really, if anyone really gets on board and really runs with it, you could heal fast. You could heal very fast.
No, it's amazing how awesome the human body is if it gets what it needs. But no, I'm just, again, like it's really awesome that it's been 2 years. And what I'm grateful for is even people that might have had a small flare afterwards, because they know what to do or they can just reach out to me quickly. It never gets to like what it was before with you. They don't lose a lot of time. They don't lose a lot of money because now they've been exposed to that there's other answers. So I'm
Yeah.
grateful that yours was, 2 session and you've been good. But some people, if it does, like for me, when I was learning and healing, I had a few flares when I overdid things. But again, I knew what I needed to do to fix it at that point. So there was no lost time and money at that. I think in my previous podcast, I explained that I had $5,000 in deductible fees for my ER visits, and I had $6,000 in insurance costs because I was self-employed. So $11,000 out with zero answers, like no relief. And so I don't mind paying money and even paying payments for years if I'm actually going to get an answer.
Yes.
But it's super hard to put out that money and
Oh
still be
yeah.
suffering.
Oh yeah. Two things, if I have time to mention two things.
Sure. Yeah.
So one of them was on the second one, I'll say, was on what you just said, as far as like, I'll mention, just if I forget, just remind me, Mayo Clinic.
Hmm.
The first one I'd say is I was on Facebook talking to a gentleman on this group. And it was a group on Facebook where people are talking about pain they're in. And
Hmm.
this guy was talking about he thought he had, some people think they have, so pelvic floor tension. They think they have, they're misdiagnosed by all these doctors for years
Yes.
with, what is it, UTI,
Yes.
and
Hmm.
then given antibiotic, and it never goes away. And other people, and so I met this. It was a guy from Germany. And says he didn't have he he thought he had interstitial cystitis. There's people that do podcasts how they have interstitial cystitis and a super limited diet, and they're better now. And this guy had 5 years, and he did. I'm in 10 months. He's got 5 years. I don't know how he did it. And I
Wow.
told him about our experience and my experience, how it was healed. And he was asking about you, like he was going to fly from Germany to Brooksville to,
Oh.
because you could have your bladder Botoxed,
Hmm.
you could have your bladder removed. He was contemplating bladder removal to
Oh.
to get rid of the pain.
Yeah.
And I would agree with him. The
Right.
pain I had, I would be like, well, what comes along with bladder removal? What's the baggage with that? Because this pain was horrible.
Wow.
It was, yeah,
No, and I have had people fly from other countries. Some people I've helped them virtually that way because I can teach a lot of people, even like your family member, how to do the muscle testing. And when we're desperate, that's what we'll do. And sometimes the person does have a great massage therapist or chiropractor or PT that I can guide through the manual muscle testing, because it's manual muscle testing that they utilize in like a traditional PT clinic. It's just attached to a different corrective than what most people have been taught. And
Mhm.
so what's great is I can typically help from afar. I like to help in person with that. But it is true, if you've been suffering 5 years and everybody's saying it can't be corrected. And like what you said, I'd say really know everybody, and that might sound like a crazy number. 100% of the people I've met with that were diagnosed with IC that a pelvic floor muscle problem, and we corrected it. And so
Wow.
that's just the label that they've come up with in the medical community because they don't know what else is happening, because they don't
Right.
understand the connection to the neuromuscular system and the bladder function and the pelvic floor, and then how that connects to maybe mental stress, nutritional stress. So if they're not looking at the big picture, they really don't know how to fix it. So you just get a label, and then we try to manage that label for the rest of your life versus address the root cause.
Right. I know when I was about 2 months before I saw you, I had a pause of anything, any medical treatment. I didn't do anything with doctors. I gave up. And I was literally, I would take 5 Advils
Mm-hmm.
and 5 shots of tequila
Wow.
in 2 minutes. Like literally, I would, we would go bowling and I would try to get rid of the pain. I
Mm-hmm.
mean, retarded. I had friends offering me oxycodone, bottles of it.
Mm-hmm.
They get it through VA, and good friends encouraging me not to do that.
Yeah.
But I was like desperate. And I asked my wife, I'm like, so what do I do now? I'm 2 months in and like into this, like I'm doing nothing. What do I start over? I go to Mayo, I heard good things about Mayo Clinic. I'm like, this hasn't been too much of it. I bulldozed through and I went to work and my doctors were relatively close,
Mm-hmm.
other than going to Sarasota a couple times. If I go to Mayo, you're talking what, 4 hour drive, round trip, overnights, missing work, and they're going to do all the same tests over again. You're going to
Yes.
pay for all that over again
Right.
and then maybe find nothing.
Yeah.
I mean, it was looking pretty bleak. So it was a great turn, you know, when
Yeah, no,
I was,
and I have the
it was,
clients from, yeah, and I have the clients from Mayo and Shands and Northwestern, and it really is only the same test, because even though there's some brilliant doctors there, they're still taught the same approach, largely the same approach. And so it's exactly what you said. You go get some more tests done, and what happens, the body's already stressed. So now the time from work, the driving, being in that position the whole time driving,
yeah,
plus all the testing upsets the body more. And oftentimes your symptoms get worse from
right.
that stress. So I'm grateful that you kind of sorted through that. But just like me, I had to exhaust multiple specialists before I sought this different path. Because one, I didn't know this path existed. And two, I thought a specialist for the GI tract or a specialist for, women's issues like gynecologists were going to help me. But I didn't understand that they just weren't taught this information. They did what they could do. But when you go to all these specialists, and then they can't help you just accept that this is going to be your life, or you think crazy thoughts about this not being your life. And so, yeah, it's an interesting journey to be led down this path.
Right. Yeah. And I can't even imagine, I mean, I'm sure you've helped people with more serious problems than this. And, and this would have pushed me to the brink of maybe wanting to not be around this stupid little pain in my pelvic area, and some people deal with worse than this. And
No.
it's like, it's hard to imagine that, people hang on for years and
Yeah. Well,
with
think
no
about it.
hope.
I mean, all men talk about how bad anything in the pelvic floor it hurts. So I could
Yeah.
understand trying to work and live with that. But no, I have had clients, one that was out at Pine Island here, and he had a gun and he was going to take his life.
Oh, yeah.
And he did not. And then we met and he healed. So
That's
I'm
awesome.
so
Wow.
grateful that he did not give up. And I'm so
Yeah.
grateful that even though you
Wow.
kept getting all these false leads, that you didn't stop seeking.
Yeah. Yeah. I guess it's personality. I don't know, but to keep leaning in but
Yeah. Yeah.
yeah.
I
Yeah.
appreciate. Before we close out, are there any other
Mhm.
things that you want to share about your journey, or anything else that you want to say before we close out for today?
Just encourage anyone that does hear this to, give this a shot, whether it's Kim or somebody else that does what Kim does. It, I would have, I wouldn't have bet that this was going to work, and it did. So just that big gap of,
Yeah.
like this is the problem and this seems impossible. It seems like a mountain, and 2 to 3 sessions, really.
Yeah.
But I was just like, what do I have to lose? But so, and if whether 10 people hear this or 1,010, give it a shot. And the cool part is that Kim she's willing to, be like almost on a retainer if you need her. In some situations, she's willing to teach. She wants you to learn this.
Mm-hmm.
She doesn't really want you as to take you on as this perpetual patient forever. She'd like to have her be a friend with you and have you on your merry way and helping
Yeah.
other people and teaching you how to do it for your own family. So that's something I really need to do and would like to do in the future. A lot of irons in the fire now, but that would be an important one, I think, to learn how to do this yourself.
Well, I'm glad you took the gamble on the session. It worked out, even though you wouldn't have bet on it working. I'm glad that you took the gamble. You
Yeah.
did a good job. Yeah.
It
No.
sounded
And,
it sounded a very like too easy to, I don't know, what do you even do? I don't know, but it worked.
yeah, you did good. There's one thing I do want to say that I need to say before close out. That's a big deal. And this has been a frustration and a passion for me for years. I have worked with multiple men that their own urologist will not talk in depth about different pelvic floor problems for men. Like if your urologist doesn't know how to talk to you, or you don't know how to talk to your urologist, who does help you? And then if some of the pelvic floor specialists and PT aren't even taught this, it's like, who does a guy go to? And that is one thing. You're a pretty open guy, but there's a lot of men that are suffering because one, they be either intimidated or like, why would I talk to Kim about this? And a lot of people think, and I've shared this in other podcasts, but not in this one. So in case it's a new listener, some people think it's like, you don't even get undressed at my office. We don't touch your pelvic floor.
No.
It's completely different than when a physician has to examine you.
That's true. That's true. I mean, because you wonder when you're going, like, is she gonna, like, this is a sensitive area. What is she gonna do? I mean, I've heard of, I don't even mention some of the treatments that I have a friend in Port Richey that told me that he went to do. I'm like, your wife let you do that? Like, can I even say it? Milking or something like
Oh,
that?
there's all kinds of stuff that
I'm
happens.
like,
And for women too, for women, they've instructed them to
you
use
gotta be kidding me.
yeah.
Some of this stuff is like almost pornographic, let
Yes.
alone if just put this white robe on and I'll be right back, and you come back in, which is what you do at my doctor and my urologist and my acupuncturist.
Yeah.
Whereas, like you said, this is like just a living room type physical therapy area, and you're never getting disrobed, and I don't even think you have to take your shoes off. I mean, this is pretty like pretty
This is a
simple.
pretty good date. Yeah.
It's like it's
No.
just simple.
Yes, you're exactly right. People
It was
often take
so
their shoes off.
comfortable.
Yeah.
I'll say this, it's so comfortable if and when you heal from it, if you've ever driven back into your hometown and you feel that nostalgia, that good feeling, when you go there, you feel that, because there's nothing, you're not going to the dentist getting anesthesia, there's nothing to fear.
Right,
So
right.
it is not. And yeah, so for those folks that are timid, yeah, that's an important thing to mention, because I make it sound kind of vague, like, what, I don't know what she does, but it's
Yeah.
it's the
No.
knowledge about what's going on inside the body. That's more of what's going on.
Yeah.
Less co-payments, less pills, less knives, just knowledge about the body, I guess. So,
Yeah, no, that's exactly it. Well, I appreciate you sharing that. And Eric, thank you so much for your time and being willing to share with others and to help save their time and money and health. Because again, this is such a debilitating problem for so many people. And you being willing to speak out about it, to me, is critical. For me, I feel like when God blessed me to be able to heal, I needed to share it. And so I appreciate you always being willing to pay it forward and put the word out there.
amen. Well, thanks for the chance. Thanks for healing me, and it feels good to share it. because hopefully someone else will get the benefit, you know? It's great. It's a win-win.
Yeah, it is. Well, I appreciate you and I hope you have an awesome day.
Thanks. Take care.